Hi, everybody. This is Randy Weingarten, and I am coming to you on Facebook Live. And as you can see, I am in my office, which is where Becky Pringle and I also did our FaceTime Live town hall with Dr. Fauci today. We have another doctor who is joining us, and that is Dr. Irwin Redlener, who I don't know if any of you know. He spent some time with us. Well, if you stay up at night and watch 11 o'clock television, you will see him often talking to several commentators on MSNBC, 10 o'clock and 11 o'clock about what is going on in terms of the COVID world. I know Dr. Redlener because of his work, intensive work over many, many years, I won't say many decades, for children's health, particularly for underserved children. He's a pediatrician. He's the co-founder of the Children's Health Fund, and he is the director of the National Center for Disease Preparedness. And he is one of the doctors that we have consulted with routinely over the course of COVID. And so, given so many questions about COVID and vaccines and mitigation strategies and the CDC, we just thought we would have basically, a half an hour conversation with Dr. Redlener. And I have lots and lots of questions from all of you about what's going on after he makes a bit of a presentation. But before I ask him to come on and thank him one more time for just his incredible work during this COVID period of time, this COVID pandemic, is that we have some good news in that we are on the cusp of getting probably the most significant piece of legislation that has been passed in decades, and that's the American Rescue Plan. And, we've been fighting for the HEROES Act, and we've been fighting for resources to deal with struggling Americans and the crises of the economic crisis, the COVID crisis, how to, safely reopen schools, how to make sure that state and local governments have what they need. We've been together through a lot of this and through all the thick and thin on a local level, on a state level, on a national level, through all the turning. This is the week, basically the week anniversary, turning on a dime. This week last year, lots of school systems were starting to close. We've started seeing a lot of our friends get sick and family get sick. And not knowing what was going on. Many of us haven't seen our grandparents since, who have grandparents since COVID started. This has been a year of hell and back. And there's some good news on the horizon. And some of that good news, yes, it's laced with still some uncertainty. But let me tell you what was in not only President Biden's plan, but the plan that passed the Senate by a vote of 50-49. No Republicans voted for this, even though they had voted for aspects of these kind of things beforehand. This bill that was voted on by the Senate and will be voted on again by the House, started in the House, goes to the Senate, goes back to the House because the Senate changed it to some extent. This bill is favored by 70% of the American people. It's the first time that you see significant Republican and Democratic enthusiasm for something that's going on in Washington. And President Biden, for the first time in years, has an approval rating. He's only been there for 6 weeks, but we haven't seen an approval rating like this for a president in quite a long time, over 60%. But what has he done? He actually put together a plan that is addressed to helping the American people, not helping himself, but helping Americans, and with geared to helping people who have struggled during COVID. So it has $350 billion. That's billion with a B, not million, to state and local governments to help cash-strap state, local, and town operations and tribal operations. The majority of the money will prevent mass layoffs, and including educators, nurses, EMTs, other essential public workers, including adjuncts, including higher ed personnel. There's $170 billion, again, billion with a B, to help schools and colleges, including $126 billion to public pre-K-12 schools, including funding specifically to address COVID recovery and what we need to do to meet the emotional, social, and academic needs of our children. $40 billion to higher ed institutions, with at least 50% required to be allocated for emergency financial aid to students. And by the way, we are still working on, and we have supported Senator Schumer and Senator Warren's push to cancel $50,000 of student debt. And we had a meeting last week with Ambassador Rice, who's the head of the DPC, about this issue. $1,400 in direct payments to the vast majority of Americans, $300 per week in enhanced unemployment insurance benefits to September 6th, $14 billion to speed vaccine distribution, $49 billion for COVID-19 testing, tracing, and research, including the kind of testing that we know we need in schools, $24 billion for community health centers, rural healthcare providers, and the public health workforce. And that includes money for the CDC to do the kind of data collection it needs to do, $140 million to support mental health and decrease the burnout of healthcare professionals. It lowers health insurance premiums for millions who buy insurance on the ACA marketplace, 100% subsidies for continuation of job-based COBRA, so that our colleagues in the private sector and also colleagues who are on COBRA can afford, who have been laid off, can actually afford to continue their benefits by this being 100% subsidy. $40 billion to stabilize childcare and the childcare workplace, $7.1 billion in E-rate funding to expand broad-based access, $100 million for emergency assistance for rural funding, $83 billion to stabilize multi-employer pension plans because of people were about to lose their pensions, the credits to public sector employers that voluntarily offer emergency paid sick leave and family leave benefits that were cut off in the last bill have now been extended in here. The child tax credit has been extended. The earned income tax credit has been extended. And I can go on and on. Those two things alone should ultimately take 50% of children from poverty. This is a bill that we've never seen before, not in our lifetimes. And so after it's passed by the House tomorrow, we've been working on that all day. There doesn't seem to be any problems. Will be signed by the president. And that, on top of having the mitigation strategies from the CDC, and on top of having what President Biden announced last week as well, which is to make real vaccine prioritization for educators, is he made this promise that said to reopen public schools in the first 100 days, we need to have safety guidance, we need to have resources, and we need to have access and prioritize access to the vaccines for educators, as well as obviously prioritize access for vaccines for other emergency essential workers and obviously for healthcare workers, in addition to those in nursing homes who suffered so badly. And last week, President Biden announced that educators, pre-K, childcare, through high school, are going to be part of the federal pharmacy vaccine programs. And in order to be part of that, teachers and staff in pre-K schools and childcare programs are able to sign up for an appointment at more than 9,000 pharmacy locations that are participating, and individuals who are interested, they can check their individual pharmacy's website or visit, sorry that I'm reading this, vaccinefinder.org, vaccinefinder.org, and the CDC also has a web page. Now, why do I say all this and say it all quickly? By the way, our guest speaker the same day that President Biden said this about vaccine access for educators, our guest speaker had an op-ed in the Atlanta Journal-Constitution pushing for vaccine access, for prioritization for vaccine access for educators, because you can't say that school reopening is important and not do the things that make it safe to reopen schools, safe for the education community, safe for the adults who educate children. And we know that that roadmap is mitigation strategies like masking and physical distancing and cleaning and ventilation. We know that it is testing for the early warning system, and we know that it was vaccine access. Now, I go through all that this quickly because there's a lot of good news here. And it shows that this president has been serious about actually trying to do what he said he wanted to do. We know that reopening school buildings is very important for kids. We know it's very important for communities. We also have to make sure that the educators who have done everything imaginable in the last year and a half or the last year, they do everything imaginable for a long time anyway, are kept safe. And what I want to do for the rest of the time here is that there's tons of questions. You have me all the time, but I want to actually ask our guest speaker, Dr. Redlener, who has really been knee-deep in this whole virus, in the epidemiology of it, in tracking it and seeing it, to actually give us his current thoughts about what's going on in terms of vaccines, what's going on in terms of the trajectory of the disease. And then where he and I have a bunch of questions from him, from you, and he and I will do that till about 7:20 to 7:25. So with that, I can't thank you enough, Irwin, Dr. Redlener, but Irwin, all of us, for always being there for us, for always being there for educators, for always being there for kids, and for always giving us your best advice all the time. So without further ado, Dr. Irwin Redlener, this is the, there could be probably, 20, 30, 40,000 people who are watching this right now. So thank you so much for everything that you do.
Well, thank you, Randy, and hi to everybody. And what a moment this is. And it's a moment on top of a year that none of us could have anticipated. Let's say a year and a half or 2 years ago would have been out of the question, would have been like a science fiction story, which turned out to be real life. The other day, my wife and I were up at our abandoned offices that we had left in last year, March, and went back, and it's like a ghost town. And it just caused us to reflect about how profoundly lives have changed and the tragedy of losing over 500,000 of our fellow citizens to this scourge. And many of those unnecessarily lost. And I won't go into the horrendous mismanagement of this challenge during the last year of the Donald Trump administration, but that was then, and we need to move on and recognize, as Randy was saying, the really quite extraordinary commitments that the president President Biden has made. And the amazing thing is, these are not just political promises. These are actual things on the agenda that are actually getting done. It's amazing, actually, and I'm really so grateful that this is proceeding as it is. We still have plenty of issues to deal with. I just want to say just a couple of words before we get into the questions. And so, listen, this horrible pandemic has, as I said, cost many lives here and around the world, over 2 million lives globally, over 500,000 in the US. And the first thing that we have to worry about, obviously, is stopping the spread of the virus and controlling the illness and deaths that it's causing. Number one priority, of course. Number two priority is the economy of our country and of the world. We've taken a huge hit economically here and in other countries. People, that's not just a kind of an esoteric academic issue of the economy tanking. It's actually the lives and the well-being of every person on the planet, every family who needs to pay their rent, who needs to buy food, who needs to understand where their long-term security is going to come from. And that's one of the things that's so great about this bill. We're just days away from President Biden signing this $1.9 trillion bill that will address many of the economic pressures that many of us are feeling and many of our fellow citizens are feeling. But the third issue for me has always been, what is the impact of this catastrophic pandemic on children? Because they will be certainly helped by the economic package, the relief package, the rescue package, and poverty will be reduced in childhood and so on. But what about the fact that children have had a profoundly disrupted educational year? What does that mean? What does that mean for all kids? What does that mean for vulnerable children? What does that mean for children who were struggling before the pandemic? This is devastating. And the challenge with children, of course, this is not just a devastating problem for right now, like the medical challenges or the economic challenges. Our failure to appreciate how badly this is affecting the education and the long-term prospects for our children, it will be horrendous. So we have to plan not just for getting kids back into school now, but what are we going to do to remediate the losses and the compounding of the challenges that the education of our children has been facing, which is one of the reasons that I am increasingly focused on what children need to do, what we need to do for our children, rather. How are we going to remediate the losses that have been sustained? And this is one of the things where AFT can really start thinking about, what are we going to do to make up for the lost year that our children have experienced. But let me stop there, Randy, and if we can maybe get into some questions, and
Great.
I'll answer anything you got, or I'll
Thank
try.
you. So that, and so I want to let's do a couple of the still safety questions, Irwin, and then let's get to this piece of it about, our kids and our own kind of long-term needs in terms of going forward. I just want to, as you were speaking, the NEA and the AFT, and we're going to get this out, the AFT and the NEA together put out a document yesterday called Learning Beyond COVID-19. And it basically has, 5 very broad areas that obviously we're focused on, including things like, diagnosing students' well-being and academic success, meeting the needs of our most underserved students. What kind of environment do we need for this summer and beyond? What kind of training and professional growth do we need to do this? And what would that kind of education system look like? And I know that, so let's start there. I know that you and I have talked a lot about things like community schools and wraparound services. And so, just in terms of thinking about April, May, June, the summer next year, what is your sense about what we should be doing in terms of emotional and social supports for our kids? Why don't we start there, and then we'll do some of the vaccine questions and some of the other safety questions.
I'm happy to talk about that if you promise to send me a copy of that document as
I
soon as
will.
possible. All right, fine.
I promise.
Yeah, so we have a lot to do. The issue of, let's just take mental health services and the social emotional development of children, and what has this year meant? Well, for one thing, for every vulnerable child who is already struggling with issues having to do with psychological well-being and mental health, and wellness, this has been a major challenge. Children have been kept out of the school environment. They've been kept at home. There's been many, many stresses there. They're far more exposed to the dynamics of parents and family members who are struggling themselves to just keep up economically and worry about the future. And the kids are now in the mix. They're in the middle of those conversations. They're hearing it day and night. They're outside of their normal social circles, which of course get manifest in schools and in the classrooms. They're missing that, and that's that kind of peer support. They're missing the support that they get from a social emotional perspective from their teachers. That's all gone. And we have children who are far more stressed, a lot more concerned about suicide and suicidal thoughts and depression, especially in older children. So a lot of work is going to need to be done just to get children restabilized in an environment that's normal, that is having them in school 5 days a week in person, where the relationships with the teacher, the other school staff, teacher, and their peers is reconstituted. All of those things are really important to help kids get through these traumatic times, but we haven't had, and they haven't had the opportunity to be in those environments for, as we're talking about, a long time. And I think that one of the things that we're going to have to do when we start seeing kids in person again is, that's why one of the reasons I'm anxious to see that document, is to make sure that we have the tools to evaluate where kids are educationally, but also how are they doing from a social emotional point of view? What problems have gotten exacerbated? What extra mental health services are they going to need as they come back into the classroom? And also, what kind of assistance will our teachers need to make sure that they feel equipped and comfortable assessing children from those points of view, understanding what the dynamics might be for kids that are just coming back into the school system after this long delay? What do the teachers need to know? And I think it's going to be a lot they're going to need to know. A lot of teachers are obviously extremely well-versed, they're intuitive, they understand the dynamics of children and their needs, but we're really dealing with a special situation. And I'm curious about what you all think about what kind of special training or additional training teachers will need.
So I think that this is, so one of the things that both the NEA and we and the AFT were disappointed about was we thought that the Biden administration should actually give the opportunity for full waivers of the standardized tests and do instead exactly what you just said, which is how we assess on a very local level where our kids are and what they need for next year. And in some ways, April, May, and June, as well as I think the summer, are going to be trying to sum up this year for the kids that are coming back to school right now. And you're still seeing in a place like New York City, probably 70, like in the high school, 70 or 80% of the kids are going to end the school year on remote. So, and so you're going to see a lot of the real stuff in terms of moving forward and helping kids. I would say the summer will be a summer where some kids will be engaged and involved, and then really next year. And so I think that we need to work together. We need to have the professionals on site. And this has been a lot of the questions I'm getting as you're talking, Irwin, like, how is this going to happen? What are we going to do? So I think we're going to need, guidance counselors and psychologists and social workers on site, because a lot of this we're going to know as non-guidance educators. We're going to know some cues, but we're not going to learn in the next weekend what it's taken, years for guidance counselors and social workers and psychologists to know, and we're not going to know what nurses know. So I think that there's going to have to be teams in schools, and there's money in the education, in the Rescue Act for this. But I also think that this whole notion of trauma-informed instruction and of thinking about how we do a new orientation for kids. Like, we have to be very intentional about a real orientation for kids coming into next year, as if kids haven't been in school with their peers for a long time.
Correct.
And so we have to actually really think about that. And we have to also think about how we make curriculum fun and how we actually engage in things like projects over the course of the year, like social studies and science and things like that. So I think it's a year next year of really trying to read the cues, because cues are going to be really different as the year goes on. And something might trigger a child like mid-year that you have no idea what's going to, that actually triggered somebody. So that this has to be not just like in the aftermath of a school shooting, you'll see lots of resources for 3 weeks and then they're gone. This has to be resources for the whole year so that people have them. There's a lot of training about cues and that we know how to actually work through the emotional social work that we're going to need to do with kids. That's the sense that we're getting from talking to others. And we're going to have it ourselves in terms of really our own issues about anxiety and about trauma and about our own families and the stuff that triggers as well. That's what we're thinking about at the AFT right now about how to do these things. That's why we're thinking about it in terms of really wrapping services around schools.
Right. So, Raina, you mentioned something in passing. I just want to pick up on. You said fun. And I don't know, yes, fun, but I think one of the things that's really important is for teachers to understand, and I'm sure most do, that though their own personal anxieties, of which there are plenty and plenty of reasons to be anxious for all kinds of potential concerns, but I think what children are going to need, all grades, is a sense of positiveness, enthusiasm. We'll get this done. We've all been through a really difficult time, but making kids feel like the teachers are into it in a very positive way, I think will go a long way in the kind of engagement that we need that'll help with everything else that we do. So the more positive, upbeat, uplifting teachers are in the classroom, the better. And this issue about more guidance counselors and mental health workers, we needed that long before, in many school environments, long before the pandemic. Now the need is exacerbated significantly. Yes, there's funding, but where are the people that we're going to hire with that funding? Do they even exist?
Right.
Where are they coming from? So there's a pipeline issue that we're going to have to address as well. And that's a big challenge for the whole educational community, of course.
Right.
But that said, it's all the more important that teachers understand, we really do wish we had more mental health workers that we could just hire tomorrow, and social workers and whatever we need. We don't have it. So a lot is going to fall on teachers themselves to kind of step up and do it. It's like with pediatricians. We're seeing a lot of children who have, mental health, emotional struggles, et cetera. We don't have enough pediatric mental health providers in general, not just in the schools. And the pediatricians are going to have to step up also. We're going to have more responsibilities to think about. Pediatricians are going to have to work on issues that they never thought about before, but they have to. This is it. It's parents, teachers, pediatricians, social workers, the whole spectrum of our community that supports kids are going to have to be looking at a whole new agenda. And I think we just have to kind of accept that and go with that.
And maybe we're going to have to, as you're talking, Irwin, and frankly, I had this conversation with my sister, who, as you know, is a pediatric intensivist at Monty, and we're going to have real community conversations amongst and between us in terms of what we're seeing and what we need to do about it, since we're all going to be learning next year at the same time.
Yeah.
So let me just, before we leave, let me just switch, just because we have you and you have watched the trajectory of the disease. So what is your sense about, vaccine access versus vaccine hesitancy right now, and this race to get people vaccinated? Where do you think we are in terms of access, and where do you think we are in terms of hesitancy?
So the whole vaccine issue is like rolling thunder now. It's moving fast. It's moving because Joe Biden says it's going to move, and we'll have every adult in America potentially vaccinated by the end of May. That means that if we do that and continue the public health guidelines of masking, separating, hygiene, ventilation, etc., we could be having a potentially quasi-normal Thanksgiving and maybe Labor Day picnics outside in parks. So I think we have the momentum now to keep rolling. I do think Biden is going to actually exceed his commitment to 100 million doses out there by the first 100 days. He's going to increase beyond that for sure. And we're in a situation where the vaccine hesitancy population and the vaccine resistors are going to keep dropping away, and those numbers are going to diminish as the vaccine is proving effective, as people really are so hungry to get rid of this pandemic. I think we'll have fewer and fewer people are saying we're not taking it, or they're listening to absurd conspiracy theories on the internet and social media. That is all going to go away, in my opinion, or the majority of it. And listen, it's really important that we get at least 70 to 90% of everybody vaccinated. And in fact, we need to get children vaccinated. We're going to hear more and more about that. And the two mRNA vaccine manufacturers, Pfizer and Moderna, already have 11 and 12-year-olds and up in vaccine trials. And J&J, at least, if not the other ones, are also talking about being able to vaccinate children down to the age of 6. I'm a big supporter of that. And the sooner we can get that done, the better. Because children, while they may not get as sick and they may not, fortunately, have fatal complications, they can be carriers. And if we're going to eradicate this thing, Randy, we got to get children vaccinated as well. I would certainly support my own grandchildren getting vaccinated as a sign of good housekeeping of approval here.
So when do you think that the vaccines for kids, when do you think those trials are going to be completed? Any idea?
Yeah, 2 months, I'd say, and we'd be ready to go for kids, young kids.
And I'm not going to ask, that's going to be a whole nother conversation about mandating versus not. Let's just see if we can get everybody vaccinated right now. Let me ask you the question about what was your reaction when you heard the governor of Mississippi and the governor of Texas decide to lift the mask mandates?
Yeah, totally reckless, irresponsible to a point where it should be intolerable. But unfortunately, there were a lot of people that agree with them. And I think we're going to see Alabama lift the mandates and other states lift the mandates as well. This is not a question of protecting or making policies that work in your community or your state. We're all in this together, and that's not just a cliche or rhetoric. This means that if we're not doing the same policies to prevent the spread in Texas, we'll have consequences that go far beyond the borders of Texas or Mississippi or Alabama. So what Texas is doing is presenting a threat to the rest of us who are trying to be responsible, and the rest of the governors who are trying to follow science and be responsible. It's pretty outrageous. You're making my my blood pressure rise.
Yeah. Oh no, I don't want to do that today. But it is. But I do think a lot of people, by masking up and by in some ways saying, I don't care what you say, Gov, we got to keep on masking up, and is really important. And I had some great conversations with our colleagues in Texas today about doing that, and about, starting to show that in terms of Facebook, and, having some actions around that.
Yeah.
Let me just ask, since I promised that we would do, when we do these one-on-ones, we don't go for an hour, we don't go for half an hour or 40 minutes. So we're getting to that. We're getting to the 40-minute mark. Let me ask you about the variant. What's your sense about what's going on? Is it, we see 3 or 4 different variants. I was on the phone with some of our colleagues from South Africa a couple of days ago. They're very concerned about it, but what do you think in terms of the United States?
So there's many more than 4 variants in the United States right now. And all the ones that we're worried about, the UK, South Africa, Brazil, are also here to some degree or another. it is possible that the UK variant will become the dominant strain here in the United States, which is a fast-spreading virus. The problem or the challenge, Randy, is this is really a race. On the one hand is the growing challenge from the variants. And on the other hand is our ability to squelch this entire outbreak, which will require many people being vaccinated and sustaining the public health guidelines of distancing, masking, etc. We could lose this race. I don't think we will, but if we don't, if we don't clamp down the spread, it's the spread and the harboring of the virus that allows it to mutate rapidly. And the problems with the mutations is that one, they may spread faster. Two, they may be more lethal. And three, these variants could become more or less resistant to the current vaccines out there. And in fact, Pfizer and Moderna are already working on booster shots that will deal with the variants in particular. So this is something where we have to stay ahead of the game, and everything we do to put us behind, like premature lifting of the mask mandates or not getting vaccinated, gives an edge to these they're mutations really, these variants, these mutation strains, gives them a chance to proliferate and become more problematic. So yeah, this is what we think. Now, if we do what we need to do, I think we can get control of even the variants and get this outbreak squelched by midsummer.
So I think thank you, Irwin. And the last question I would do is, in light of that, you got a lot of educators who are on. We've taken the position, I know this is going to be a layup, but we've taken the position that the way you reopen schools for the rest of this semester, and probably for the summer, is you got to have the mitigation strategies that CDC has put out. That those mitigation strategies really do stop transmission.
Yep.
But for those places that have had high COVID or can frankly do it, we're a big believer in testing like New York City is doing. New York City schools is an early warning system. And frankly, by doing that kind of testing with real clear closure, opening protocols, you can actually keep schools open because you're really fighting the outbreaks.
Yes, you are.
And then this kind of as many shots in the arms of educators as possible, because that is that kind of layer of protection that, God forbid you get the variant, God forbid you get exposed, you're not going to get as sick. And so we've said that those are like the big three. And what we've seen is that when teachers and, trust is created in the education community when, when teachers and parents and administrators are working together on this kind of stuff. So do we have it right?
You have it right. And it's actually as complicated as this year has been and these challenges are. The answer is really pretty simple, Randy. It's what you just laid out. We have to follow the guidelines. We have to get people vaccinated, and we have to get kids back in the classroom as soon as possible. But I would like to close on another note.
Absolutely.
So it is really important now, really more than ever in my memory, that teachers from K through 12 or pre-K through 12 are focused on how children learn to understand truth, how they learn to appreciate science, and to separate, BS from actual knowledge, and to get comfortable with uncertainty and the scientific process of iteration. This is how we learn. We don't learn from conspiracy theories. We don't learn from listening to nonsense in social media. And if teachers could really reinforce how people could obtain knowledge, this would go a long way to preventing some of the issues that we're now struggling with. It's a long-term investment in what kids need, and a really, really important one. So I think it's a good time to reinforce that whole notion, Randy. So thanks for letting me share that.
I couldn't, I mean, hallelujah chorus to you. We know that if we can actually really focus on science and civics, and you just said something about really teaching the iterative process and being comfortable with uncertainty, which is what the scientific method is. I mean, I often tease Irwin that I don't even play a scientist on TV. I'm the social studies teacher and the lawyer. But what you just said is so important from the social studies perspective. How do we help kids discern fact from propaganda? How do we really analyze and make sure that misinformation is, when you see it, it's clear. And so you don't get to the big lie again. And so there's a lot that is on our plates for next year and for the end of this year and next year. And if we can actually re-envision education to deal with these things, to make science interesting and fun, and that kids want to go into it. Kids want to be the next Kizzy, and to make civics fun and interesting. All of that stuff is going to be, we'll then look at this period of time and say, not only did we make it through as we mourn those we loved and lost, but we'll make it better. And we'll not just reimagine and wish that our schools are going to be more about the whole child and really focused on how we, help all kids thrive. But we will have actually reimagined our education system to make it better. And I think you leaving us with those words is really, really meaningful. So
this is going to be the decade of the educator, Randy. I'm telling you, this is front and center for your entire profession, and people should recognize that, and and feel like the spotlight is on you, but for really good reasons, and you can make an unbelievable impact. Excuse me, on the future of our society. So thanks for. I'm going to share some thoughts with you. So
thank you so much for being with us, and thank you for those kind, wonderful last words. And the people I have the honor to represent, the healthcare workers, the other essential workers, the educators. It is an honor of my lifetime that I get to represent them every single day. They are amazing folks, and thank you for sharing your incredible knowledge and compassion, Irwin, with all of us tonight. Really, thank you.
Anytime, Randy. Thank you. Good night.
Good night. Thank you, everybody.